All right, well, good morning, everyone. My name is Jack Hovenier. I'm the co-chair of the Incarceration Prevention Reduction Task Force. It's a few minutes after 9 o'clock on Monday, July 18th. And I'm now calling this meeting to order. And as we start, I do want to read our land acknowledgement statement that we acknowledge we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Simeama people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. So we begin this effort today to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present, and please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And I believe our agenda will be in order today. I'm not aware of any changes to it. Are you, Stephen? I think we're roughly following it today. Okay.
Yeah.
All right. Although we reserve the right to try to move with efficacy and make things work. But with that, Barry, I think we're going to move right into an update on the Justice Project needs for the purposes of the task force.
Oh, thanks, Jack. Good morning, everybody. I'm Barry Buchanan with the Whatcom County Council and the chair of the steering committee of the task force, and as well as chair of the Stakeholder Advisory Committee, which is doing this work we call the Justice Project. I check in every month with y'all about this project. So last time I think we talked, I had talked about the meeting we had in early June, which is when the BEGAT team, which is the Behavioral Health Gap Analysis team, that's Perry's work and his crew. They went through the sequential intercept model with us. They had updated to include things that had not been noted on the earlier version of what we call the SIM, or the sequential intercept model. So we went over that and had a lot of follow-up emails and things, questions about things. So we had scheduled an additional co-chair meeting with the behavioral health co-chairs. That would have been Mike Parker and Dan Hamill, Councilmember Hamill. And those folks met 2 weeks ago. They had a great session. We keep going over time on these because of the enthusiasm of our Stakeholder Advisory Committee members. Attendance has been great at every subcommittee co-chair meeting and every meeting. So we went over kind of some of the questions that they had. And then the very next week, last Thursday, we had our SAC meeting number 4, which was to kind of reaffirm the things that we had learned through meeting 3. We went over vision and goals for the group, came up with some agreements. We talked about, during that time with the visions and goals, we had conducted a survey within the confines of the Stakeholder Advisory Committee to gauge those values and visions. And so we had some data to reflect on from that group. And then we talked about the various things that were talked about as far as gaps go from the BEGAT team that presented on the June meeting. And we prioritize those in, we categorize those into categories such as community behavioral health services and gaps, in jail custody, in custody behavioral health gaps that are in the jail. We talked about reentry and I don't have that agenda right in front of me. What was some of the other things we talked about, Jack and Stephen? Reentry, and we talked about, what's that, Jack?
Housing
was the other one. And then the last one we talked about was the wish list. The wish list was something that Caleb and the Behavioral Health Advisory, or the BEGAT team, put together in terms of needs for facility space for that programming. And so we presented that to the group kind of as an initial, kind of almost a teaser to what's to come in our next meeting, which is going to be about facilities, which will be in mid-September. So that's where the group stands at this point. We still are meeting weekly with the planning team, which is Jack and I and Stephen, and our staff, which is Jill and Kathy and our consultants. But things are moving forward. I look forward to getting some hard things in front of that committee in terms of facilities coming up in September. So any questions, I'd be happy to take them.
Yeah, really.
This is thinking way out of the box and probably not a possibility, but can we bid on them all? You can put your treatment center on one end, you can put your mental health, maybe some housing in there, couple courtrooms, the jail, I don't know, just like I said, way out of the box.
Well, interesting that you should say that. Executive Sadhu sent out a kind of an info email, just kind of announcing that opportunity exists late last week. So we haven't talked about it at all yet, of course, but that's certainly an interesting concept for the county to look at for sure.
I think some ARPA funding would be, helpful as well. And just, anyways, go on.
Thank you, Raylene. Mayor Brodez.
I see a screen of 9 of you, but am I not a panelist? And there are only 9 people at this meeting because I don't see everyone here this morning. And so
Mayor Courthouse, you're logged in as an attendee. I sent you a panelist invitation.
Okay, I'll go along. Oh, there we go. All right.
Okay, now you're a panelist.
Okay, anyone else? Oh, yeah.
There's Scott.
Yep. You are muted, or is that a thumbs up that you're good?
Good.
All right. Okay. Great. That happened to me at the SAC meeting the other day. I don't know what happened. Anyway, it happens sometimes. Some of it didn't happen in a conference room. Anyway. All right.
Barry, I may have missed it, but did you mention David Goldberg's survey?
Oh, no. Thank you, Stephen. Thank you for reminding me. David Goldman.
I'm sorry.
Yeah. David Goldman works for Whatcom Community College, and he administers kind of the general education contract in the jail. So David goes in. He's been doing this for years. He goes in and teaches in the jail. And we corralled him and got him to volunteer to do a survey. So he's going into I think he's underway now. He's doing a survey, asking a set of questions that was developed by the planning team to inmates as well as staff. So we can get some data out of the jail from people that really do have that lived experience and are living the experience at the time of the survey. So that'll be some interesting data to get. I thank Stephen for reminding me. I had that on my notes, and I left my notes at the courthouse. So.
All right, seeing no other hands, I think I'm going to turn this over to Stephen for the pre-trial services work group and unit discussion.
Thank you, Jack. We haven't had an update from on pre-trial processes work group efforts, which entail the implementation of the public safety assessment as a pretrial risk assessment tool for Superior Court judicial officers, and the operations of the pretrial services unit, which was created within the Superior Court to monitor people released through the risk assessment instrument. I've communicated recently with pretrial services unit lead John Krause, and I see Dave Reynolds, administrator of the Superior Court, on the call. John is not. Dave, do you want to field this, or do you want me to just report on the information that you and John passed on to me?
You can go ahead and report on that, Stephen.
Okay. So there were a couple of questions, and I think the first thing to say is that the public safety assessment created by now I'm blanking on the foundation. In any event, created by the Arnold Foundation and widely accepted across the country as maybe one of the best and most neutral risk assessment tools, has been implemented in the Superior Court for some time, but only to a limited extent because of the backlog of trials, extensive booking restrictions, and the limited ability to monitor people who are released. Most people have been released regardless of risk assessment scores, but nonetheless, since January 1st, 2022, there have been about 750 public safety assessment scorings done on people so far this year. So that's a bit over 100 per month. The only people who are being scored are the people who are still in custody at their first appearance. The many people who have been booked and released do not get scored because they don't have enough interaction with jail staff. Pretrial services staff are the ones who score those who are taken into custody, and all of those scores are presented to the judicial officers at first appearance, unless court was canceled or there were some technological failures. I'm not sure what constituted technological failures, but for the most part, if you appear at a first appearance hearing, the judge is going to have, their judicial officer, usually a commissioner, is going to have that score. For those who are released, awaiting trial, about 55% of those also have some bail attached to them. That's an interesting statistic and something that the work group may want to explore further with the judiciary and with Dave and John for the pretrial services. The risk levels for the PSA can be low, medium, high. In an optimally functioned system, that would suggest differing levels of monitoring. At the present, the risk levels are not recorded in the PSU. There is an intention to have the software that goes along with the public safety assessment updated in the last quarter of the year. This could be one of the things that's added, so we have a little more data on that. The fact of that update flags for me that Caleb, we may want to have John and Dave work with you and try to identify index information that we want to try to add on that update so that we're getting a comprehensive set of indicators for pretrial services. For those people who are released with a low or a medium tier score, they have an interview over the phone within 24 hours of release. For every court date, they get a court reminder, which I believe is a text reminder. They have a monthly phone check-in requirement. They can volunteer for referral to services and any other special conditions that are imposed as a condition of release by the judicial officer are also followed through on. In addition, periodically, there's a criminal history check on those. To the best of my knowledge, there are no non-compliance hearings being scheduled and dealt with for people who on release who are not complying with those conditions. I believe that information is passed on to the court. I'm not sure what follow-up takes place on that. And that's the information I have, mostly from John with Dave's oversight. Dave, if I've missed anything, misstated anything, or if there's anything else of relevance that the task force might want to track on this at the present time, please feel free to jump in and add anything.
I don't have anything additional, Stephen. Thank you.
Okay, thank you. Appreciate your cooperation on this. The pretrial processes work group is back to meeting about every other month. We were meeting every month for a while, and we're back to every other month. We will be following up on this. I think as court activity and trial activity start to pick up and the backlog starts to get taken care of, we may see a little more activity in pretrial services. But I think the biggest obstacle here is the inability to book many people into jail. So that as long as those restrictions remain in place, we're not going to have as many people scored as ideally we would in a fully functioning system. And we're going to be stuck in that rut for a while, obviously. I see Judge Freeman coming on, and I'm going to pause. Judge Freeman, I've just reported some data on the pretrial risk assessments and the monitoring from the pretrial services unit. Is there anything you want to report from the court's perspective on pretrial issues?
I don't think so. And I just want to apologize to the group that I just came off the bench. So I was otherwise.
Perfectly understandable. Wanted to give you a chance to weigh in if there were any issues or concerns or any data that you want to transmit.
Thanks, Stephen.
Sure. Any questions on what I've said? Raylene, I see your hand.
Thank you. Do we know if there's a time frame that there might be non-compliance hearings? Do we know when data will be able to be accrued once? I mean, I guess it's kind of hard to say that we're going to be able to get accurate data until some of the jail restrictions are lifted, but how many people have actually been through the screening process? How many people are actually compliant with the interviews afterwards and are responding? And what's the funding look at once this actually starts to work the way we expected it to pre-COVID?
I think I mentioned that according to John, about 750 people had the pretrial risk assessment scored for them since January 1st. Mm-hmm. What I don't know, and Caleb, I don't know if you have a guesstimate off the top of your head. What we don't know is the number of people who are booked and released and since the start of the year and therefore not scored. That would be an interesting data point to gather.
I don't have that off the top of my head. It's certainly something I could look for.
Okay, that would be great. So there is data to be gathered. I do think from everything I understand that the booking restrictions and the slow pace that the courts are getting back in the trial backlog are the main holdups for this. Until some of those kinks in the process get worked out, I don't think anybody thinks we're going to get data that is very, well, it'll be reliable, it'd be accurate, but it wouldn't really tell us, the full picture of what we want to know about how pretrial risk assessment, pretrial monitoring is going.
I think my only other question, and thank you for that, Stephen, would be, is there any other pretrial monitoring for felony offenders that they're looking at in the future, such as 24/7 alcohol monitoring for DUIs, whether it be with a scram bracelet or with IIDs? Are those requirements mandated when somebody's got their 4th DUI pending?
They're not mandated. They're not resources that the Superior Court Pretrial Services Unit has had available to this point. I asked that question, and Dave Reynolds indicated that he's already sharpening his pencil for developing the 2023-2024 budget proposal. So that would be the place for any costs like that. And I'm hoping that the pretrial processes work group, of which Dave is a part, will be discussing some of those enhanced monitoring capabilities so that we have a little closer hold on some of the higher risk people that are released. The best practice is to release people even with slightly higher scores, just have a closer monitoring of them while they're out in the community, make sure they remain available, and to make sure they are not committing especially new violent crimes. Heather, you had your hand up. I'm sorry, Raylene, did that deal? Heather, you had your hand up.
Thank you. Will you tell me more about, you said that the jail booking restrictions are limiting the ability of the pretrial services, and I'm not sure I understand why or how that works. Can you tell me more about that?
The people who are, as I understand it, the people who are booked and released do not get to a pretrial services unit staff member. Those are the people who score the PSA. So the people who are detained, who are booked and detained, do meet a PSA staff member. They do have the PSA scored, and that score is available to the judicial officer at the first appearance hearing. So it's that group that are just turned around right in the booking area and released right then and there, who don't get scored, and therefore we don't have data on them. We don't have numbers, we don't have scores.
And what makes it so that we can't somehow find a way to score them even if they're not booked and staying there?
That's a good question. It's above my pay grade. I don't know, Dave Reynolds or Judge Freeman, whether you have any sense of the logistics of that.
Well, I think if they were to score anybody being booked and released, we may be holding more people, because if they come in at a higher score on the risk assessment, the judge may actually, if they got to a first appearance, could detain them at that time. The purpose of the risk assessment is to determine whether or not somebody should be held or released. The booking restrictions are already determining they're being released.
But they also, when they are scored, when they're part of this, don't they also receive support through the process?
There's no reason that the court can't put them on pretrial services absent a risk assessment. When they have their arraignment or any time during the court process, the court can put them on pretrial services and has at some stages.
I'll just add to that. I think it is common, and I don't cover the arraignment calendar, but it is common that the court may impose pretrial services at first appearance arraignment, even if they've been booked and released. What the court doesn't have is the risk assessment tool, but it certainly can require pretrial services or monitoring nonetheless.
In those cases, Judge Freeman, would you do that without running the PSA?
You would.
Okay.
Yeah.
And Dave Reynolds, I hate to put you on the spot about Raylene's question, but are electronic home monitoring bracelets or SCRAM bracelets or other slightly more enhanced monitoring resources, are those things you're contemplating? Are those things you're trying to work into a budget proposal?
I'm setting aside professional service dollars that can help cover those costs. I still, after doing this for so many years, I don't know what the barriers to people being successful on this program are. It could be EHM, it could be scramblers. We don't know, and it's be really helpful to know what would be helpful for these people to be successful. I feel like we don't have a good picture from Dr. Peterson about risk factors, and so it makes it a little difficult to determine exactly what we're going to do.
And that's a great point that Dave made in his notes to me earlier. Is again trying to follow evidence-based practices. We need to be determining that. We may well, I think Bruce Van Glub from District Court is on this call also. Bruce may have some data on that, but that would be for a different different defendant population. And we're working with Dr. Andrew Peterson from the Administrative Office of the Courts. And he probably will be our go-to person to try to nail down some of the evidence-based justifications for certain monitoring resources. Bruce, I saw you come on for a second. Did you have anything you wanted to add?
You know, I didn't, unless there were some specific questions.
I think we'll leave that for subsequent work in the work group. Try to address that there.
Okay, no, that sounds great. Thank you.
Okay. Raylene and then Heather again.
Sorry about that. I think one of the concerns and frustrations that I hear is that we've got individuals that are booked on misdemeanor charges that aren't getting booked on misdemeanor charges, or they are and they're being quickly released. But there's some concerns about domestic violence victims that are released. We are using GPS monitoring, which isn't a fail-safe, and people are still going to violate orders even with the GPS bracelet, but at least it gives us a little bit more creativity on trying to keep the victim safe. But when we're seeing defendants that are booked, released with these conditions, and then there's felony domestic violence coming after for the same defendant, whether it's in the same county or different counties. I guess if we're only having compliance phone calls and we don't have other options and there's no room at the inn, I see frustration on many different various levels, and I don't know that there's a solution. I just want to point out that there is definitely some concerns about victim safety without more restrictive measures. But I also understand that these people are not necessarily convicted of a crime. And so there's concerns about requiring people to do monitoring when there's not a conviction. Thank you.
Thanks, Raylene. Duly noted, and DV crimes and the differences that that those pose in pretrial release are an ongoing topic of conversation in the work group. Heather, you were next, and then I see Dan Hamill's hand up.
Stephen, I know that before implementation, there was concern about could this have outsized impacts on people of color? And I'm wondering if that demographic data is being tracked and if any of that is playing out, or if it's showing that that's not the case in our community.
I think we're at the same point we've been for a little while with this, Heather. The PSA has been validated in a number of jurisdictions, and it's shown to be at worst neutral in terms of racial breakdown of people who are released, and often improves racial equity in some jurisdictions. That's why it was chosen by the Superior Court judicial officers, because of that track record. Dr. Andrew Peterson from the Administrative Office of the Courts, who I mentioned, is working with a number of jurisdictions in Washington State and tracks national implementation of the PSA as well. We have lasered him in on racial equity considerations. We've also recruited a couple of community members of color to work with us when we look at the post-implementation data to make sure it is performing in that respect as in others, as we hope it will. However, at this point, for the reasons we've been talking about, we don't have data that could give us an appropriate validation of those kinds of considerations. So until we return to some approximation of prior normal functioning in the whole system, I don't think we're going to have data that can tell us that with enough certainty. We're set up, we're structured to pay attention to that. That is, if not one of the top 3 priorities of the whole pretrial process's effort. And I'm confident we'll get there, but we're not there yet. Dan.
Two questions, one for Caleb, one for you, Stephen. What is the capacity of the downtown jail facility and the work center? And then the second question, Stephen, if you can you remind me of the source of the pretrial risk assessment? What foundation or what organization that we sourced that from?
Yeah, I can do that, and then I'll turn it over to Caleb. It was developed initially by the Arnold Foundation, or before that it was called Arnold Ventures. And it was initially a piloted proprietary program, which they then put out into the public domain. It's being used in Yakima, King County, a couple of other jurisdictions in Washington State besides ours. It's been adopted in various jurisdictions across the country. Hope that's responsive, Dan. And Caleb, I'm sorry, go ahead.
Follow up real quick. Yeah. So my concern with that is that pretrial risk assessment tools are not celebrated by communities of color because they're inherently risky when it comes to over patrolled communities and neighborhoods, and people get popped for drug busts that then could end up being something else. So I'm just wondering, has GARE weighed in on this, or has the Arnold tool been vetted by communities of color or organizations that represent them?
I'm not aware of any GARE involvement in this. We'll talk a little bit about the complications there when we get down the agenda a bit. I think the community concerns about any risk assessment tool, including the PSA, continue unabated. And just for the whole group to recap, the concerns there are that every risk assessment tool as a predictive factor includes as part of its scoring the defendant's criminal history. Criminal history comes out of a system that I think most people now acknowledge historically is riddled with racial inequities, beginning from street level law enforcement through implicit bias in sentencing. And so that's sort of inextricably interwoven with the data that yields a score in any risk assessment. The conundrum here is that when you're looking at trying to be predictive and making a release decision on who will return for the resumption of their case and who will be less likely to commit new violent crimes, criminal history is the most powerful predictive factor of those considerations. And so it has both in a data and predictive way a necessary place in a risk assessment, and it comes with immense, unavoidable, undeniable baggage obtained to it. There are some risk assessments that don't pay so much attention to the problems inherent in risk assessment. The public safety assessment is generally considered, at least it was when we adopted it, I don't know of anything different, is generally considered the most aware of that. And as I mentioned in answering a prior question, Dan, it has been looked at in terms of how it actually plays out in use in any particular jurisdiction. And it's been found to be neutral or positive in terms of reducing racial inequities. In other words, I think the first time it was studied was in Yakima, where there had been a high disparity for Latinx populations, partly because of law enforcement interest in gang activity there at the time. And when the PSA was implemented, used for a while, and then studied in terms of how valid a predictor it was, it had actually reduced the racial inequities with the Latinx population in that jurisdiction. So there have been a couple of studies like that. Dr. Peterson tracks those because we've asked him to. And so the alternative to a pretrial risk assessment is subjective judicial opinion, and the data is at least as strong that is problematic in its own right for racial inequity considerations. So it's the best of some unsavory choices in that field. It would be interesting to try to find out whether GARE or anybody involved in any of the GARE groups have experience with that or other risk assessments, whether there is developing feedback in communities of color anywhere that GARE members operate. And I think that's probably worth exploring. As I say, it's one of the top priorities for the pretrial processes work group is to pay attention to that and make this an improvement rather than a compounding factor for inequities. Caleb, I think Dan was also asking about capacity of the jail and the work center.
Yes, so I'll start with the work center. It's easier. The work center has 148 beds. The downtown jail, as many of you know, was built in 1983 with 148 capacity. It opened in 1984, and in the early 2000s, I've been saying it enough, I've forgotten which exact date, 2004, 2005, somewhere in that neighborhood, was expanded to include additional bunks on top of existing bunks. So adding a second bunk where one existed, which essentially increased the operational capacity to about 212. That has been reduced by one because we've removed one of those permanent bunks for a special case that comes in quite frequently that cannot be on a top bunk. And then we also have a massive variety of people in custody now, and many of them cannot be housed safely with one another. So almost all of the top bunks are useless for us at this point. This morning's population is 182 downtown and 105 at the work center. And operationally, we're attempting to ship people over to the work center as many days of the week as we can. It's a matter of making sure that they're qualified to go over there. And I think that's the answer, unless there's other questions.
How long do you anticipate these booking restrictions will last?
It's hard to say. The major problem at this point is the booking restrictions are not sufficient. When we did spot checks a week ago or 2 weeks ago to determine how many of the people who are in custody were fully sentenced, downtown at the time, we had somewhere on the order of 200 people, and 2 out of those 200 people were fully sentenced. So as you can imagine, that has a dramatic impact on the amount of time people spend in custody. They're not getting their cases resolved. And so at the work center, we found that there were 10 out of the 120 or so that were there that were sentenced. And that makes more sense because we actually put people who are fully sentenced out at the work center more often, but we just don't have enough people getting their cases resolved. So it's not simply a matter of stopping them coming into the facility. It's also a matter of getting them out at the other end. And we're sort of stuck in this process where we can't really get people out of the facility with any regularity when they're not getting their cases resolved. So I don't see an end to the booking restrictions. In fact, I see them being more restrictive if we continue on the trend we're on now. For example, right now, today in July, we're right around 45% increased capacity to what we were in 2021. So our average daily population has steadily increased to the point where we cannot manage the populations that we have in the conditions that we have.
Thank you, Caleb. Other questions, Raylene?
Caleb, what is this current staffing discrepancies or needs right now for the jail?
So we're down 11 positions in corrections. We're down 1 behavioral health specialist, which is a contracted position. We're down a contracted food service provider, what we call a food services director, which is the kind of the kitchen manager. And we're down I think one full-time nurse as well. So we've got a number of positions that are opening and need to be filled. And we're running short. Everything is running short. Our transport unit is running short. Our all of the specialty units that we have, classifications and jail alternatives, they all pull from their own staffing to backfill the other staffing needs. So we end up running short quite a bit.
Thank you.
Dan, you're back up.
Thanks. Question for Chief Mertzig. What is our current status with any other facilities other than Whatcom County in terms of jail facilities?
It's my understanding that August 1st was going to be kind of a target date for contracting with Snohomish County, but I don't know where the sheriff is at on that. Maybe Caleb could fill me in. I don't know.
Yeah, that is my understanding as well, Chief. I don't have the contract in front of me, but that was the latest target date given by their staff and their legal team down there in Snohomish County.
Can I follow up, Stephen?
Yes, please.
Chief or Lieutenant, who is the contractee? Is the city of Bellingham the entity that contracts with the facilities down south, or is it Whatcom County Sheriff's Office?
For this particular contract that we're discussing, it is an interlocal agreement between Whatcom County and Snohomish County. That doesn't preclude any other agencies from holding additional contracts, but this particular one is an interlocal for 45 beds between Whatcom County and Snohomish County.
Lieutenant, do you know the cost per bed?
I don't know the cost per bed. The projection for 2022 is $1.2 million. 2023 is $3.3 million for those 45 beds.
I can also add that I know Snohomish County does a flat rate for their beds. So regardless of the needs of the person being booked, whether they're have mental health issues or substance abuse issues, it's the same rate across the board.
This is all really helpful information. Thank you, Chief, and thank you, Caleb. And thanks for the question, Stan. Darlene, I see your hand.
I was just going to mention that the city of Bellingham has also contracted with SCORE down in Des Moines. And so there are defendants that are being transported down there as well.
Thank you, Darlene. Okay. Any other questions? I don't see hands. Very good. Thank you, everybody, for a really informative discussion. Jack, I'm going to turn this back to you for the next agenda item.
Thank you, Stephen. And that would be our public communications update. We actually have an update on that. And Barry, we are back to you on that one.
Thanks, Jack. Yes, we have, as you all know, we put in for funding last year for a communication specialist consulting to come in and help us, get the word out to the public what the task force is doing, what it's accomplished. That budget authority was approved last fall. We developed a RFP for that effort. It went out and we had some responses back, and we ended up with Pyramid Communications out of Seattle, and they have the council has approved that contract. They did that in late this spring, And so far, we've had one meeting with them. We had Jack and I and Stephen and Jill met with the group, just kind of a preliminary kickoff, just to discuss alignment on some of the statement of work that was placed into the contract. And there was a lot of alignment, just at initial meeting with them. It was very refreshing to see how well they kind of understood, what our needs are. So the real official kickoff is coming up on August 10th at 3 p.m., in which the steering committee will be meeting with the group, Pyramid Communications, to really further dive into the specific needs, the various campaign items that we want to talk about to communicate out to the public. And Jill, if you had anything else to add, especially on the logistics side, please chime in.
No, you've got everything. Thank you.
Okay, thanks.
All right, are there any questions about the communications strategy in the contract?
Looks like Darlene's got her hand up.
I think that's left over, but is it Darlene? Yeah, that was from the previous. Thank you, though, very.
Apologize, sorry about that.
No problem. Okay, I am going to.
Dan's got his hand up.
Oh,
that's a new hand. I saw that one.
That is a new hand.
Yeah.
It's a new hand. To what extent will this communications group be discussing or putting out that the task force has been working with the SAC, the stakeholder advisory group for the committee for the new jail facility? I'm curious as to how that will be communicated out to the public.
So we actually have a separate communications consultant for that effort. It's through VITA Communications, and they are the ones that are going to be handling the communication out from the needs assessment process that Dan just talked about through the Justice Project. So we've had one meeting with them, and then we did a follow-up. We had a few alignment issues on statement of work, which we ironed out last Friday, actually. So now we're going to be proceeding on with the first thing they'll be coming up with is an overall plan, a public engagement plan for that specific work, with the stakeholder advisory committee and the needs assessment. They're going to be done with that by sometime in August, so we can roll right into getting into the actual implementation of those recommendations for our plan. So we're trying to get this really ramped up quickly, so we have a lot of information out to the public early this fall.
And I'll just add that both of these contracts are recognizing and planning to communicate the inner workings between the task force and the stakeholder advisory committee, especially in the direction of the expertise and time and energy that task force members have been contributing. You being one of the major ones of those, have been contributing to the understanding of SAC members in gathering information that they can make recommendations on.
Yeah, that was one big topic of discussion on Friday, was how the task force is integrated into this process, and how we're utilizing all the structure of the task force, the subcommittees, and so on to do this work. So we feel pretty good about the meeting on Friday. I think the questions that we had were answers. The questions that they had were answered. So we're going to proceed on.
Thanks, everyone. Anything else? All right, I think we are ready then to move on to the discussion of the updated sequential intercept model and the service inventory for the Justice Project. And I know that Perry is involved with this, and it looks like the introduction, Stephen, is you and I and Perry. Do you want to take the lead, or should we just start over to Perry, or how would you like to proceed?
Let's start with Perry. He's the one who knows what he's talking about.
Good morning, folks. Perry Mowry, Response Systems Division with the Health Department Supervisor, and also have had the opportunity to work with a wonderful team, the Behavioral Health Gap Analysis team. We fondly refer to them as BEGAT because it's too much of a mouthful to continue to say. And I believe that folks have received in the task force, that folks have received the most updated version of the sequential intercept model. Again, we finally refer to it as the SIM, as another mouthful. The SIM update that resulted from the work of the BEGAT is at this point dated the 6/29/2022 SIM. And just super short version of this, that the team got together, reviewed the SIM that was developed by the Incarceration Prevention Reduction Task Force 2019-2020. We updated the services. I think that folks are pretty familiar in Intercept 0 through Intercept 5 that are currently in existence. We didn't actually remove anything from the original task force SIM, but we certainly did add items that have developed, between that period of time, et cetera. Also, the SIM is, the framework of the SIM is in 3 different tiers. Those tiers are programs that are currently in place, programs that are in place but need resources in the BEGAT's perception, and also the final tier, the bottom tier, being those programs that we believe are needed in the community but don't currently exist. So as we did this work, as the BEGAT did the work from March up until recently, did presentations, as we've talked about, to the Stakeholder Advisory Committee, we also went through a process of offering a rating scale. It's made reference to in the bottom of each of the page of the SIM that were items identified as 1, 2, and 3, 1 being the program services that would have the highest impact and effect on jail population, and then working down to number 2s and number 3. So we just spent a little bit of time discussing it amongst subject matter experts, behavioral health, housing, prevention services, that sort of thing, and offered some prioritization of that. Those prioritizations are placed in Tier B and Tier C as well. So a couple of things came up, and boy, anybody sort of redirect me, but when we received this, again, it was a task force document that had been developed some length of time ago, and the behavioral health gap analysis team got together and updated and did a variety of things and made recommendations and et cetera. But the discussion really also came about of how do we bring this back to the task force? How do we have the task force then review this? And we even titled this particular document, the Behavioral Gap Analysis Team Intercept Model, just for clarity that this was not the task force that has had their hand in it at this point, which is a very important step for that to occur. So my understanding again is the intent here is the introduction of the updated sequential intercept model, as we knew when we were involved in it and doing the work, that it was a perspective of about 13 individuals with subject matter expertise, but certainly did not include, wider input. We did, during the process of the BEGAT update of the SIM, we did reach out to a number of different groups and entities with surveys, asking for, we used a draft SIM, sent that, and also sent survey questions to just get input and information, thoughts from individuals, looking again at our process and trying to understand that further. So we did receive a pretty significant amount of feedback from 21 different groups, entities, in that information, and just really wanted to, I think, continue that process on and again, have the task force review that. I believe, again, an additional document that accompanied the SIM was also the a gap analysis chart. Short version of this is that we took those number 1 rated items and feedback that we had received and put them into a chart if folks haven't had a chance to take a look at it. This is really reflective of those #1 items that we identified as reducing jail population, and then carried it out further with recommendations, intended outcomes, and some estimates for certain portions of it. So we wanted to bring that work in terms of sort of the culmination of that. And if you have had a chance to look at it, this is where Barry was making reference to this before, that we broke this out into community behavioral health needs and gaps, housing services needs and gaps, jail behavioral health services, and then also reentry. And again, wanting to bring information to the task force in at least my perception, and please correct me if I'm wrong, that ultimately adoption of the sequential intercept model by the Incarceration Prevention Reduction Task Force, and then carrying that work further from there. Hopefully I've touched base on the primary topics here in regards to this agenda item, and happy to answer questions and receive input. Thanks.
Yeah, and I'll just add to Perry's really comprehensive summary for task force's clarity. I think this is before you today as an introduction. We're asking you to review it closely. We're going to bring it back next meeting and ask for actual approval of the updated information that the Big Ad has developed for us, so that it once again becomes a task force adopted tool for our use. Realizing that it gives sort of the totality of the services available. It points to adequacy, sufficiency, inadequacy kinds of considerations, which could have funding implications for recommendations the task force may want to make, and also as a community education tool and a planning tool for us and for the citizenry who looks to our work. Jack, anything you want to add here?
No, thank you. All right. Oh, we have one hand. Perry.
Sorry, just really quickly, that if folks aren't as familiar with this, one of the areas that I worried about, kept me awake sometimes when we were doing this work, were some of the intercepts. And folks, I think if you're taking a look at it, obviously it moves from intercept 0 through intercept 5. These are arenas of where an individual may come in contact with the judicial system. So certainly, focusing on your area of expertise, because we didn't have, for example, individuals that had expertise in terms of initial detention and court hearings. We reached out to those individuals to get some input and so forth, but did not have a sitting behavioral health gap analysis team member in those regards. We get a lot of input, really important input from law enforcement, as well. But those were arenas of where it's like, I'm not really knowledgeable about these programs, what occurs within those programs. And so I worried about those, particularly intercept 1 and 2, possibly 3, lacking because I wasn't aware of programs or information. Again, we did reach out to various entities just to ask them to take a look at it and give some input, but that would be particularly helpful from my perspective. Thanks.
Well, I guess after that, Perry, the one thing I will add, and I think this is obvious to everyone, but it bears repeating. This is a living document that's informed by all of us. One of the best parts of all of us gathering in this kind of a setting with the different perspectives is the discussion, of course, we just had about pretrial and the things there, but also on this tool, it's informed by what all of us know, and we're trying to gather because we understand there is not one person that knows all of it, and we have to try to collect it and put it together so we can see what we really have. So thanks. So if you have, and Perry, is it best if people just email you with that information?
That is perfectly fine to me. I think that folks, I'm obviously on the county contact site. That's a great way to initiate that. I'll certainly include others, you know, in that information as I receive that information. I don't know what Jill would have to say about that, just in terms of appropriateness, in terms of communication, the task force, that she may have some thoughts there as well. So I'm just trying to stay out of trouble with Jill.
Mm-hmm. That's great. Everyone can go ahead and email Perry. Thank you for checking.
Yeah, I think if it's just like a single idea, I think Perry's really good about answering his phone. I can say from personal experience, and he calls back pretty quickly. So anyway, so there's good ways to reach him. All right, and thank you for that. And I think now, Stephen, I don't see Mike on the call, so I believe I'm turning the GARE discussion over to you both to facilitate, disseminate, and perhaps call in folks that can help you with it.
Yes, I'll do that and have some words with Mike at a later date. So just to recap, Mike Parker, I think, has been one of the champions of racial equity considerations on the task force, and especially in linking us up with the Government Alliance on Race and Equity, GARE. And so Mike, myself, Jill Nixon and Jackie Lassiter from our support staff have been meeting a couple of times, intend to meet again soon, to discuss ways to implement some steps that move us more toward a robust racial equity piece of our work. I want to say that there are really two pieces of this, analytically. One is the first thing we stumbled on, which was the Racial Equity Toolkit, which comes out of GARE, but is a public resource that they've made available to anyone who wants to use it. Seattle city government uses it. Number of places use that. It's a simple, deceptively simple, I think, set of 6 questions that guide a policy analysis and a decision-making process for public policy and public action. Separate from that is GARE itself, the Alliance as an organization. That is a membership organization. And I think with some encouragement from the task force, the county, both the county council and the county executive in their differing leadership capacities, decided and carried through on having Whatcom County become a member of GARE. Those of us who had been championing that cheered at that step, because we thought it opened us up to the resources that GARE provides its members, which include a library of racial equity focused tools and resources, information, guidelines, similar to, but much more extensive than the Racial Equity Toolkit itself. It opens up a possibility for periodic trainings for GARE members. There are email subgroups of like-minded GARE members who exchange information, make queries of each other, look for examples, look for best practices, look for cautions to be aware of. It's really sort of working groups of people supporting each other across the country on racial equity considerations. We thought we would have access to all of those GARE resources. It turns out that GARE means what it says when it talks about Government Alliance for Race and Equity, and it is open only to government employees. We thought, since the task force includes a lot of government employees, but also is entirely at the service of government employees, that we might have access to those resources. turns out, as far as we can tell, and we've made a couple of efforts to explore this, we are not eligible for those. So there's part of our effort, and part of what I'm reporting on is an attempt to work around that obstacle and open up access for task force members to, for instance, trainings, resources, communications with colleagues across the country from whom we might gather or to whom we might give information on our work, learn from their work. Right now, we're having to strategize about that. This was discussed at the last steering committee meeting, and I think where that was left was that Councilmember Buchanan and County Executive Sadhu would be trying to schedule a meeting where the two of them and Mike Parker and myself would try to figure out ways that we might jump up and down, beg, whatever we think might be effective in approaching probably the executive director or the membership director of GARE, and see if there was a way that we could make GARE resources more available to the task force. More to come on that. We're still working on having that discussion and trying to come up with a plan of action for that. But that would be a big step forward for us in terms of improvements in racial equity within the task force domain. And I will say that it wouldn't just be for the Incarceration Prevention and Reduction Task Force. If we can open that up, it would affect all of the county's boards and commissions, most of which have now articulated a priority on attacking racial disparities in Whatcom County overall. So it would have a broader community benefit than just our task force. The other parts of what I can report on are continuing discussions on how to implement the actual use of the toolkit. Dan has promoted that, encouraged that a couple of meetings ago, and we've taken that urging seriously. We're looking at ways to implant the toolkit questions in the work that we do. We're looking at possibilities of including those questions as prompts, at least to the co-chairs and chairs of our subcommittees and to Jack and I in the task force agendas, so that we have some reminder, some assurance that we will bring up in our discussions the questions that the toolkit poses for our consideration. A side question there is wondering exactly where in the process of task force and subcommittee work we raise those questions. Do we do that on every topic of the agenda? Do we do that only on action items to make sure that we don't take an action or make a recommendation before we're certain we've run through those questions and taken into account racial equity considerations? Do we? So what in our language so far in those discussion groups, question is, what are the triggers for taking up the questions of the toolkit? And I think we're looking at a couple of possibilities for how to do that. No decisions yet to be made. Lastly, we're looking at the possibility of some sort of formatting where we would actually record as part of our public record the fact that we have addressed racial equity toolkit questions in at whatever points in the process we decide would be appropriate. That serves a couple of purposes. One is it gives us a record to look back to in the same way we can look back to recordings or meeting summaries to remind ourselves of what our conversations touched on for racial equity factors. It also provides a public record to our community members, our stakeholders, to assure them that we are taking racial equity considerations seriously. So in the same way they could look back at one of the recordings of our meetings, they could also look back at a documentation of the consideration we gave to questions in the racial equity toolkit to see whether to their satisfaction we've addressed those questions. All of those are things that the work group that I mentioned is working on. Jill is in the process of trying to schedule another meeting. This will probably be a fairly regular, if not monthly, at least a regular kind of report back to you as we make progress and as we come up with concrete proposals for actions within the GARE framework. I'll entertain questions, comments, and I see Dan at the ready.
Okay, so both the city and the county have put forward and passed resolutions declaring racism as a public health crisis. I think, so I'm just gonna give some context real quick and then provide my opinion. So when Prosecutor Ritchie developed the LEAD program, it was to, one of the main things that the LEAD program was to do was to work towards limiting disparities within the criminal justice system as it relates to race and ethnicity. When the prosecutor also was a key member, along with Heather Flaherty and several others, in creating a racial equity commission and working towards limiting those disparities, eliminating them. So I think that this organization should be an active anti-racist organization. It should be one of the number one or number two things that we do as an organization or as a task force to recommend to the county council that we work towards eliminating disparities within the criminal justice system. So I guess my perspective is that we should have GARE as active as possible within the work that we do. I don't know if that's just action items or if it should be, even reporting out. We're all going to report out here in just a few minutes. What does that look like, and what are the practicalities of that? So I want it to be as widespread as possible. I think that should be our charge.
Thanks, Dan. I completely agree with that. I think what I was trying to report, and maybe didn't do it clearly enough, is I think all of us have felt that we have made those statements of principle, and that we're trying to get down to the nuts and bolts of how do we implement that? How does that show up every month in the work that we do and the conversations that we have? So I think the practicalities that you're encouraging are exactly what we're trying to pin down and set up a series of those in ways that do make us an anti-racist organization. So I completely agree and support what you said.
Can I just follow up real quick?
Please.
So we do a land acknowledgement statement at the beginning of meetings, which I have very mixed emotions about now after hearing feedback from Indigenous folks. We can't just say words and then check the box. That we cannot do that. We have to actively be engaged in the work, roll up our sleeves and do it, and make it a part of the actions that we take. Otherwise, they're just words. So I feel very strongly about making sure that we are integrated as much as possible in anti-racist work. So I'll leave it at that. I'll get off my soapbox.
No, it's an important soapbox to be on, and I'll just join you on there for a second for one more round of back and forth. The racial equity toolkit, I'll just remind everybody, isn't words. It's what have you done on this question? It asks you, what data do you have to support the decision you're making? How have you connected with affected communities? What are the pros and cons in terms of the impact that your decision might have on affected communities. So it's actually concrete. It is action oriented. It pins you down to justify in racial equity terms processes you're considering, actions you're thinking of taking, recommendations you're mulling over making. So to me, that's the concrete, practical doing of that, more deeper, much further beyond simply making statements. And so again, I agree with what you're urging us, and it's the kind of implementation, it's the kind of nitty gritty that we need to have if we're going to make those words real. So I have Jack and Arlene and Raylene that I see.
Thanks, Stephen. I think Dan and I are largely in the same wheelhouse, but I would probably make my comments about the GARE toolbox as it relates to this task force perhaps slightly differently. So the way I view this from a leadership role in the task force, clearly the role of this task force was not to implement racial equity in Whatcom County. That's not the role of the task force, nor was it ever. But the issue of racial inequality permeates and is rippled through our work. And I think the opportunity that came for this task force is to take the GARE toolbox, and I think in many respects to try to be an example of how a committee or a group would execute that. And my hope would be that we ideally set a standard, but also tailor that standard as we do more, we know more. In other words, as people look at our work, the public, the officials and so forth, whoever's looking at our work, they understand that this lens of racial equity was applied to everything we do. The execution of that, I don't think is known yet. I think we're still trying to figure that out. And I very much support that as a principle. I think it's a wise principle. And I think we have an opportunity to be leaders in that this group seems particularly willing to work on it. We've had excellent support from the administration, and I hope we continue to. But as to how we do it, I'm not sure yet. I think that that's something we're still discussing. Steering will address it. And Dan, I was struck when you mentioned the land use thing. Now I could be wrong. My memory sometimes fails. I think you were one of the proponents, if not the proponent of that. And my thinking on that is, I know it's well-intentioned. I know it's very well-intentioned, but I think as we do things as a task force to achieve our principal goal of racial equity, if we find we're doing something or tried something that didn't work right, let's course correct, let's adjust it, because we're in new territory here. I don't think there's anything wrong with making some changes and trying to improve as we go forward. So I guess those are my thoughts, is that we try to be leaders in this, we try to be examples of this, while still being mindful of our basic charge, understanding that in our basic charge, we need to use that racial equity lens. Thanks.
Thank you, Jack. And I'll just add that I don't think this work, I don't think trying to figure out the how of this is anything individual to any of us. We are good people, I'm willing to credit us with. But really, to me, the core of this comes out of the expert analysis we got from the Vera Institute. It looked at our system, it looked at our scope of work here, and it said, folks, you've got racial disparities in Whatcom County. So I think that's why we're doing this. We were called to do it as one of the key areas that we can make improvements in ways that prevent and reduce incarceration and do it in humane and equitable ways. Arlene.
I'm really glad for this part of the discussion right now, because it also bothers me very much to listen to jargon and words and generalizations. I want to hear specifics. I want to hear exactly what people are doing, the behaviors, the changes that we are making in our specific departments. I particularly want to hear from law enforcement. What are you doing literally to recruit people from different groups what you're doing amongst your members to see to it that they do not practice any kind of discrimination or bias. But on a personal level, each person in this group has opportunities to make a difference and to show the leadership. So think about what you specifically do. You know, my way of doing it is to try to make bridges between people. I try to make relationships with people who are representing people of color or doing work in their community. Reach out to those people. This is one of the things that's wrong in Whatcom County, is the lack of connectedness. It is not an integrated community. It is not. Groups are separated. And it's our job, if we're going to be leaders, it's our job to bridge that separation and encourage and invite and meet for coffee and go visit groups to make the connections that are necessary in order to make these changes. It's not going to happen by talking or writing or making statements. It's that person-to-person thing. I mean, I remember an example when the mayor was trying to recruit for the fire department, and she said she couldn't do it. But it takes her going for a meeting, for example, into the Latino community, to maybe church leaders to ask for assistance and for connectedness to people in the community. You have to reach out. You have to go the extra step. It's not going to happen passively.
Thank you, Arlene. Raylene?
Thank you. Dan, I agree. We need to do something that's not just a statement. And I don't think that was the intention or should be the portion of the land acknowledgement statement. I think it's more than that. But coming back to this, we're on the infantile stages of implementing the GARE program. And some of this is very difficult to do with our current data because we already know it's skewed due to the pandemic. But we can lead by example, and I think it starts with each committee and with the beginning of each agenda for each committee meeting. For example, if we go a little bit forward to our reports, one of the things that we just talked about in the Legal and Justice Committee was the tablets that are being used by inmates. And Caleb was so generous in giving us information on what they're currently being used for and what we could look forward to the future on that. But what we want to try to do now is the data gathering at the beginning of the meeting. Is like, who are using the tablets? Who is somebody? Is it race? Is it ethnicity that's impacted? And then once this new program starts and an RFP, we need to look at the questions given in GARE and how it's going to impact those individuals. And then we need to come back and revisit this topic, say January and February, once the project has been implemented with the new guidelines, and we can look at the data, who's incarcerated, who's been benefits from this, what are the recidivism rates. And so we're looking at it each time that there is a new topic on each agenda or an ongoing topic, and to see how it's being impacted and how we can gather the data. And I honestly think that we need to assign somebody in each committee as a role taker to be looking at each subject matter and try to make sure that we're adding the GARE tools or a tool like GARE to figure out what we're doing in the future.
Thanks, Raylene. And I will say two things to add to that. Number one is part of the reason we adopted the data dissemination policy, you know, asking Caleb to gather a set of reports and distribute them periodically to us, is to have a look at that data. I suspect that we will find it doesn't give us the racial equity data that we want. So that will confirm for us one of the tasks that we need to do in the data set, or it will show us some racial equity data. So I do think we are trying to get at that. And I think the idea that every, your last suggestion that every matter that we bring up, we answer those questions, we deal with that. How to do that is one of the things that we're talking about coming forward with some ideas about. We'll have lots more discussion on these concrete ways to move this issue forward. And it's not something that we're going to settle and be done with. It's going to be an ongoing effort. Was there anybody else with a hand up? Jason, thank you. Go ahead.
Hello. Good morning, everyone. Speaking of racial inequities, my camera just doesn't work with me, y'all. I need a better camera to highlight me. I just wanted to give some kudos to Heather, Dan, and Arlene, and even Jack, which you mentioned. I just think what y'all are highlighting is spot on, and that's exactly what we need in this community is folks who are speaking truth to existence. And because a lot of times we resort back to status quo interventions that are not effective when we're trying to talk about racial equity. And I just really wanted to give you all some kudos for speaking up and being advocates to solving on some level, as much as we can, the racial inequities within our community. And just I know we're not at that, it's a previous agenda, and I didn't mention this, but if I heard correctly, we're about to allocate $1.2 or $1.3 million to contract with another county to house, quote unquote, folks with low level, from my understanding, could be wrong, low level offenses, when those allocations should be redirected or kept in our own community for service providers who are doing this work, who are not funded adequately. It's just imagine if we put those resources back into community partners who are trying to do this work, but just don't have the resources to do this work, so we can actually focus on prevention. That's where we're failing in our conversation right now. And I understand we talk about it, but we don't put action behind it. To what Dan is speaking to, that's being anti-racist. And so I just wanted to pause there. The main goal that I wanted to highlight here was just giving you all kudos. Arlene, you're speaking exactly how I love to do things, and that's relationship. But what I found in this community, even being one of the only Black executive directors in this community, is that when I'm speaking truth, people get turned off and then they want to attack me. And that is inherently the problem. It's like we can't even have a conversation and build relationship, because as soon as I bring up race, you can't play the race card. And that is so detrimental. It's traumatizing. And that is going to keep us held back, y'all. I just wanted to speak that. So that's it. I'll get off my train for right now, so.
Well, kudos back at you, Jason, for speaking that truth. Caleb, your hand is up. I think you might want to respond to some of Jason's comment.
Yeah, thanks. And thanks, Jason, for the question. The $1.2 million for this year and the $3.3 million for next year is not for low-level misdemeanors or any low-level offenders at all. We do not routinely house anybody who is a low-level offender. We have space issues across the board and very stringent booking restrictions that prevent anybody from coming in who doesn't need to be in the facility. For the most part, broad brushstrokes speaking, people are not being booked into the Whatcom County Jail in either facility unless you have a serious felony or a domestic violence or a DUI or an alcohol-related driving offense. And then almost all of those alcohol-related driving offenses are released when sober. So there is nobody that we're holding for any length of time isn't here on very serious charges for the most part.
Okay, thank you all for the rich discussion, to be continued, I assure you. And Jack, I'll turn it over to you for committee updates.
Thanks, Stephen. All right, we are going to kick this off with Barry and the steering committee.
Thanks, Jack. Actually, we have covered literally everything that was on our steering committee agenda meeting for this past July meeting. So there's nothing really other to report, anything else to report on. I do have a question though, and I think I have my answer to my own question, and that is the regular steering committee will be on the 4th of August, and then the 3rd or the 10th of August is a special meeting. Is that correct, Jill?
Yes, that's correct.
Okay, so steering committee folks, I just want to make sure that's on your radar that we have 2 meetings in August. The regular meeting is on the 4th, and then the special one with Pyramid Communications to really kick off that communications project will be on the 10th at 3 p.m. And I just noticed it wasn't on the back of our agenda. It wasn't scheduled for the steering committee. So just wanted to add that to our radar screens. That's it for the steering committee.
Thank you, Barry. I've noticed that pattern. Our agenda has seemed to preempt all of the steering committee.
Well, and that's a good thing because that's our job on the steering committee.
So. Absolutely. All right. Thank you. And as a reminder, those committee meetings are open to anyone, and the subcommittee chairs, as well as the co-chairs and so forth, meet there, plan the agenda, and try to frame the discussions for this group. Okay, the Joint Behavioral Health and Legal and Justice Systems Committees. Who wanted to, Dan, are you reporting on that today?
Oh, I'll take a shot at it, but Raylene and Arlene, you gotta jump in and help me here. That it feels like it was like many meetings ago. So, and they all kind of blur together. Have you all noticed that on Zoom? Like because we're dealing with the same kind of subject matter in criminal justice reform. So we did have a meeting. It was back in June. Let me pull it up real quick here. It was June 14th. And we had a couple of presentations. One was from NAMI, the National Alliance for Mental Illness, and they presented on their Clubhouse International model. It's pretty fascinating. So it was Alan Friedlaub and Ruth Davidson of the Clubhouse Startup Committee. And the Clubhouse Committee, or the Clubhouse is a way for folks who have mental health illness to engage and have a sense of community. They're referred into by primary care physician or other medical providers. About half of the folks that are Clubhouse members are employed, compared to about 15 to 20% of the general population who are living with a serious mental health illness. They currently have a budget of about $200,000. They're contracted with the Healthcare Authority. And things look like they're like that's going to be a good trajectory for that group. Folks had many questions, and that presentation went on for quite some time. We had another agenda item, which was the mental health sentencing alternative, and that was Lisa Vanyo presented on that one. That went into effect July of last year, and that the length of time for a mental health sentencing alternative is anywhere between 12 months to 3 years, depending on the criminal history and the offender score. The judge must determine, that's the determining factors is the bench, basically, in terms of if the person can be in that program or not. And we tried to get to the Whatcom County Alternative Response Program, but we were pretty limited. Perry Mowry presented just a little bit on that one. This is kind of the trend in these joint meetings, where we just have really content-rich subjects, and we talk about them for hour and a half, and then we run out of time. Just editorializing a little bit here, I think that those meetings are really important. The crossover between legal and justice systems and behavioral health is evident. I feel like the SAC members who have attended get a lot out of it. And I just think that we are doing our level best to try to inform members of the community, the SAC in particular, because they are presenting to the county council recommendation on a new jail facility. Yeah, I think we're doing everything we can, and I just wanted to give kudos to Raylene and Arlene for just being a part of this process, and Mike Parker, who I think has family in town, or he's got some reasons on here today, but thanks to the leadership, and just humbly doing whatever I can. Thanks.
Thank you, Dan.
Thank you, Dan. Any questions for Dan? Stephen, would you like to take the next one?
I wanted to check and see if Raylene and Arlene wanted to add anything to Dan's summary from.
I think Dan pretty much nailed it on the head on what's been happening and what we're discussing. I think the only thing that I saw missing a little bit is sometimes when we get into these things, we have an overlap of unfunded mandates on a lot of our discussions. Maya Lisa Vanya brought that up on the need for funding for some of these programs, as well as a lack of mental health providers, which seems to be across the board on almost all of the topics. That I don't know how we're going to bridge that gap, but we really need to push on getting more treatment providers in our area across the board in all different venues. Otherwise, I think that hit almost everything on that last meeting. Arlene, did you have anything else?
Okay, well, the transition is easy enough because Arlene and Raylene, you're on for separate meetings of the legal and justice systems.
Yeah, and sorry, Raylene, I didn't follow up. Thank you for catching us.
That's all right. I think I already touched on a little bit from our legal and justice by bringing in that we did talk about tablets being used in custody. We also had Perry Mowry discussing the co-mental health responder program, and hopefully that went to council. I believe it was supposed to go to council the night we had our meeting, and hopefully that was approved, if I recall correctly. But it looks like we're on board to move forward with that program, I believe, and he gave kudos out to Deputy Clicks and Deputy Bauman as essential parts of that program. And Perry, do you have anything more to add on that?
Indeed, Raylene, the contract for the funding for the co-responder contract that comes through the Behavioral Health Administrative Services Organization was approved as part of our Integrated Care Network contract with the Health Department last Tuesday, and the 26th, the actual positions they were introduced last week. And so they will come in front of the council for vote and hopefully approval on the 26th as well. So, yep, moving forward with that, we're really excited about it, and it's been wonderful to work with the sheriff's office, and particularly Deputy Clicks and Deputy Bauman as well.
Thank you, Dan, and then Arlene, I believe.
I just wanted to provide a quick update on the city's alternate response team. I contacted Erica Lautenbach, the Whatcom County Health Director, and she said that they're still on track to recruit for next month. So August is when they would be recruiting. And in addition, we have a sort of related, we have an ambassador program that the city has in our downtown core. And I work downtown. I see them walking around and contacting people on a regular basis. So it seems to be effective. So just wanted to update on those two pieces.
Thank you, Arlene. You're on mute.
I just wanted to mark the importance of this particular change and improvement in our system of moving mental health issues away from law enforcement and into the department where it belongs in the first place. So I'm very excited and happy for this change. I know it's a step on the way to the ultimate system that we really want to have in restoring people and healing people instead of smacking them around. Forgive my bluntness, but I'm happy.
Thank you, Arlene. Is Stephen, is there anything else I missed on legal and justice?
No, I think that was pretty comprehensive from my recollection as well, Raylene. Thank you. And thank you, Arlene. Heather.
You know, I've been really troubled this morning by I think it was the data Caleb shared, and I want to make sure I got it right, that 2 out of the 183 in the downtown jail are sentenced, meaning the rest are pre-trial, and 10 out of the 105 in the work center. That, I just think that is shocking and appalling and troubling, and I find it just challenging to reconcile how we could, how is that possible? And I'm wondering if the Legal and Justice Subcommittee could start looking into that and creating the work plan for what is the case management issues and with the courts or the offices, or how can we get those case management things back on track and get our system internally working, especially as we look at the priorities next year. I just don't think the answers should be, let's just build a bigger building to put everybody in because the system's failing and we just need more room. I think it needs to be a dual track of let's figure out what's failing in the system, and also consider facilities separately. So I'm feeling pretty passionate about this, and I'm just alarmed, and I want the entire committee to really hear that. I don't know how we can just move on from that. Like, it's just a stat that we just accept. So thank you.
Thank you, Heather. Caleb, and then Raylene.
Yeah, thanks, Heather. I want to make sure that it's clear that was a moment in time snapshot, right? This is somewhat, it changes plus or minus every day, but it is a staggering statistic, right? One building having 2 people that were fully sentenced, it's a completely non-tenable situation. And I agree with you, building a bigger building isn't going to solve this problem. What my concern is, though, is that we've got people in here right now. And so that's why we have to figure out what is a better solution for the people that we're dealing with. It doesn't seem as though case resolution is the answer, although I think it should be, but it's not, we're not there yet. And so really we're in this position where we have to find alternate housing for folks simply because the courts have said we have to hold these people, and it isn't fair to hold them all in this confined space with no natural light and the conditions that they're in. And so we're trying to do the best we can with what we've got. And that's the reality of the situation right now. Case resolution has to change, and booking restrictions aren't doing enough. So thank you.
Thank you, Caleb. Raylene.
Heather, I agree, it's a tragedy and it shouldn't happen. But there's so many different factors that are involved in this. And I mean, right now they're starting to do trials. I'm hearing more trials going, which is very positive, but then you bring in a jury and then somebody comes down with COVID and then they start all over with the jury selection again, because you just eliminated a pool. That's just one example. Then you also have the Western state issues and their restrictions, and you're bringing somebody back in that has mental health issues, and then defense counsel just had to start over with that person and doing an investigative detail. And then you've got the jail shutting down because the elevators aren't working. So defense counsel can't get in there to have a confidential meeting with their clients, which also delays the system. So it's like they're just getting hit from all different sides. So do we have another facility that we can do trials out of? Do we have more judges? Do we have more defendants that we can bring, or not defendants, but people? Is there a bigger jury pool that we can pull from? I mean, and then when you do that, then you're looking at security, courtroom security. Is everything set up? I mean, I just know just from the small municipalities that we were looking for larger spaces for other courts to proceed. And I don't know, maybe Dave Freeman or Maya can enlighten you more on some of the issues, but I'm just, I know it's just not one avenue, and trying to fix it all is, I don't know how to do that.
If I could just reply really quick, I agree, and I see that it's really complicated and many systems have to line up. And I still think that your committee could potentially look at, well, what are the top 5 issues even, and ask some questions about what's possible around these things. Is there space? Is there a different way we could bring juries in? And I just think somebody's got to start asking the questions and finding out why. Otherwise, we just accept a broken system. So sorry to chime in there, but thank you.
Thanks, Heather and Raylene. Dan?
Yeah, I want to ask someone who's smarter than me, maybe Judge Freeman or Prosecutor Ritchie or Defender Vanyo. Can we do competency restoration locally? Is that possible? I'm just, this is to Heather's point. I mean, if there are things that we can do to kind of break the logjam here and get people restored and get their cases resolved, I mean, is that possible? And I don't know that, so I'm asking the group.
Any takers for Dan's question?
I mean, yeah, I'll say that, I mean, the court orders the department to provide the restoration services, and there are certain people who will have to go to the hospital to get the treatment and education needed to be restored to competency. I have seen clients who sort of restore themselves in our jail when they comply with medications and get adequate mental health services in our jail. It's not going to happen for everybody, but yeah, I think if we actually had adequate, it would help that if we had adequate mental health services and treatment in our jail to potentially, I mean, it could help. Some folks, it will never work for, some folks are not restorable. And then that's just this lengthy process that we have to go through. That's just the way it is, but there, and eventually, I mean, they are, well, that's for out of custody, so it doesn't really address it. Hopefully there will be eventually some out of custody local restoration options. And then when those are in place, when our county is provided with those services by the state, then attorneys will be in a position to argue to the court, you should give this person a PR, you should release them on their own recognizance to do this treatment in our community locally. And some folks that will work for, and others who are charged with maybe more violent or serious crimes, it won't work for. So there's little places where we could make improvement, but not big improvement. It really is the state hospitals.
Steve, can I follow up real quick?
Yeah, real quick, Dan, a couple other hands up.
Sorry, this is pursuant to the SAC discussion. So the SAC is trying to figure out, we're building a building, or that's a proposal, but what other things can we do to reduce, to Heather's points before, what can we reduce, how can we reduce the numbers of people that are pretrial? And that's the issue, and I'll stop there.
Great, thank you, Dan.
Yeah,
Arlene, I'm gonna let Barry go first.
Yeah, okay, so I've had this conversation with a lot of the folks that are involved, the public defender's office. I've talked with Judge Grockmal. I've talked with several of you on this call about this issue. And what I've done last week, I sent out an invitation to start a work group to start working on what we might be able to accomplish through the state, getting either a regional facility, a local facility, some funding for those kind of things. And just what do we need for authorization or certification of a facility like that from the state? I'm not sure exactly what all those rules are, but that's why I want to start, asking that question with this broader group. And hopefully everybody that is on this call has gotten that from me that I sent it out to. And we'll be able to kick off that conversation and to really start looking into what long-term fixes we can do to that system, because it is one of our big log jams.
Thank you, Barry. And just to be clear, you're speaking specifically about the competency restoration process.
Competency restoration piece, yes.
Yeah. Okay, Arlene, thank you for your patience. I'm sorry.
I see it as a money and a leadership issue. It's very expensive to provide care for people who are severely mentally ill. You've got to have psychiatrists available. Anyone who's in the service community knows how low we are on psychiatry and how expensive it is when you do have psychiatrists. So you have to have constant care for someone who's you're trying to restore. Plus you need probably daily counseling. You know, they need tremendous support to do this. So it is doable and it costs a lot of money. And that's why mental hospitals are so expensive. It's because of the training and the experience of the staff. It requires the very highest level. And those are the highest paid people. And if you want it, you have to pay for it. It's just the way it is.
Thank you, Arlene. I'm going to just note editorial here that we've really gotten rolling on a number of subjects here. And so this has been a useful meeting, I think motivated in part by some very legitimate frustration with a lot of the facets of the current situation that we're trying to deal with. That's not a bad thing, but I think this is the beginning, but this isn't really a super forum, especially in the context of a report from a subcommittee to grapple with some of these ideas. So Raylene and Arlene, I don't know where you are with developing the agenda for the Legal and Justice subcommittee meeting, but maybe you could touch base with Heather and Dan and a couple of other people to see if you can roll a discussion about the current issues and maybe some creative ways to make some progress with some aspects of that. I don't know, someplace where we'd have a little more room and have a little more thought behind it. I'll just toss that out as a possibility for you.
Stephen, I think Arlene and I would be happy to put that on the next meeting. The one thing I want to point out though, and I'd like help, so anybody that has information on it, is what's the status with Eastern State? Because if that does shut down, this is a whole new ballgame. It's going to get worse before it gets better.
So maybe looping in with Perry on the interplay with behavioral health systems issues would also be useful.
Thank you.
So thank you all for the committee discussions and more. Next item on the agenda is other business. Is there any other business? Caleb.
Sorry, just to jump in, I did a quick search while we were meeting, and since the beginning of 2022, there have been 174 people who were booked and released. What we call book and release means that they were accepted for booking but immediately returned to the streets. Of those people, 134 had at least one Superior Court matter, and every other one of them was a misdemeanor. So 40 misdemeanors, 134 felonies, just statistically speaking, for this year. And this is one of the things that Stephen had asked earlier and I wanted to follow up on.
That relates to who's getting scored under the public safety assessment. Thank you, Caleb. Okay, Jill, is there any public comment?
It doesn't look like there are any in-person attendees in our conference room. We have a number of attendees virtually. If any of you would like to speak to the task force, please virtually raise your hand now. And no hands are raised.
Okay, thank you very much. Well, we have our next month's work cut out for us. So with nothing else to do today, I'll adjourn the meeting. Thank you all for taking part.
Thanks, everyone.